1, 2, 3, go.
Hello, Andy. How have you been feeling?
A bit worse, actually.
I see. Is that indicative of the whole week or just today?
Probably the whole week.
Okay. Do you mind if I look at the forms I had you fill out?
Sure.
Okay. It does look like your depression score has increased a little this week compared to last week. Did it feel that way to you?
Yeah, it did.
Okay. And why do you think you are a little more depressed?
Well, my wife and I have been arguing on and off this past week. It all started when she came up to me the other day and told me about a job at the local grocery store. They were hiring for a cashier position.
Oh, if I could interrupt you for a second, what went through your mind when she did that?
I felt like that's all she thought I was good for. That's all I amounted to being now, a grocer or cashier. She just didn't understand that those are not the types of jobs I'm looking for, nor are those the types of jobs I'm supposed to be doing.
Did anything else happen this week that led to the increase in your depression score?
Well, the other day, one of my friends asked me to go out to lunch with him, and I got anxious and made an excuse not to go.
Who was it that asked you out to lunch?
A buddy of mine, Robert, from a company that used to do business with mine.
So the possibility of going with Robert to lunch affected your anxiety and depression this week.
Yeah, I guess it did.
Okay, looking over your anxiety forms, it does look like your anxiety score was a bit higher this week as well.
Mm-hmm.
Okay, if you remember last time we talked about the difference between thoughts and feelings, as well as the cognitive model. Do you understand the difference, or would you like to review it?
I think I understand it, but could we review it, please?
We can certainly do that. Okay, so to understand the difference between thoughts and feelings, we need to first take a look at the structure of the cognitive model. The cognitive model has three parts. The first part is the situation or event, and whenever a situation or event happens, we react to it, usually on an emotional level. What people tend not to realize, though, is that the situation itself does not determine how we feel. In between the situation or event and our feelings, automatic thoughts come into play. So an automatic thought, in a sense, always precedes a feeling. Automatic thoughts are quick and evaluative thoughts we have that are not the result of deliberation or reasoning. They usually spring up spontaneously and are often quite rapid and brief. As mentioned previously, we are far more likely to be aware of the emotion or behavior that follows rather than the automatic thought itself. Even people who are aware of these thoughts, they tend to accept them uncritically and believe that they are true. They do not question these automatic thoughts at all. A common mistake that people make is they tend to confuse thoughts with feelings. They say things like, I felt that my wife did not understand. However, feeling is an emotion. An example would be, I feel happy, I feel sad, I feel angry, or anxious, or embarrassed, and so on. Keeping with this example, the correct manner of speaking is that you had the thought, my wife did not understand, and then you had the feelings such as, I felt angry. Do you understand?
Yeah, I think I understand a lot better now. Automatic thoughts come before feelings or emotions, although we usually have a hard time noticing them. So the cognitive model, did you call it?
Yeah, it's called the cognitive model. That is correct.
Right. The cognitive model starts with the situation or event, and then the second and third parts, respectively, are automatic thoughts, and then reactions, which can be emotional.
That is also correct.
Also, I feel or I felt statements must have an emotion of some sort. Anything else would be incorrectly speaking about a thought.
Again, that is correct. Good job. You certainly seem to have a better understanding.
I think so too.
Okay, now that we have reviewed the difference between thoughts and feelings, we can move on to setting the agenda for today's session. You mentioned arguing with your wife and not being able to go out to lunch with your friend Robert.
That's right.
So would you like to put both of those on the agenda for today?
Sure.
Okay, and I can write them on the agenda as arguing with wife and lunch with Robert.
Sounds good.
Okay. I should remind you, though, that our session today is shortened to 30 minutes. That being said, if we could only get through one topic in today's session, which one would you prefer we discuss?
Well, I don't see how arguing with my wife is necessarily my fault. It's her that doesn't understand. Not being able to go to lunch with Robert is more about me, and actually it's a problem for me.
So you would prefer we discuss lunch with Robert for today's session?
Yeah.
Okay. Before we get into discussing that, would you mind if we review your homework from this past week?
Okay.
Okay. Were you able to complete your homework assignment?
Unfortunately, no, I wasn't able to.
Okay. Was there something that you were confused about, or was there something that I did not explain well enough, maybe?
No, you explained everything just fine. I understood what I was supposed to do. I just forgot to do it.
That's all right. However, I would like to remind you that the homework assignments that I give you are a very important component of our time together. Therefore, it is very important for you that you do them, as I do my best to give you assignments that address your concerns and are also in line with your goals for treatment.
I understand. I did set an alarm on my phone to remind myself to do it, but I didn't turn it on.
I see. What if you were to set your alarm for your homework during our session and confirm that the alarm is on before you leave?
Yeah, that sounds like a good idea.
Okay, I agree. Can you think of any other ways that you could remember to do your homework?
I don't know. Maybe I could put notes in the refrigerator or something like that.
Yeah, that's certainly a good idea.
What have some of the other people who you've worked with done?
Okay, if you give me a minute to think back, other people I've worked with have done exactly what we've suggested so far. They've used their smartphones to remind them, or they've posted notes on the fridge. Others have even coordinated homework with other activities that they always do, such as reviewing their homework while they do laundry or wait for dinner to cook. Sometimes they even do so while they're exercising. Do any of those sound like something you would want to do?
Yeah, I think I'll stick with my smartphone or posting notes on the fridge for right now.
That's great. Both are certainly valid solutions. Okay, Andy, next I would like to try an automatic thought record. We have already worked on identifying and evaluating automatic thoughts in past sessions, but I think using this form will help you to do so at home. It is simply a more organized way of writing down what we have done previously. And by applying your present concerns, I think that you will gain a better understanding of this form, as well as better your ability to identify and evaluate your automatic thoughts. If you agree, I would like to go through the entire sheet and fill in every column for today's session. Okay, so here we have an automatic thought record, and as you can see, Well, before I get into the directions, I would like to tell you a couple of things. The first is that spelling, handwriting, and grammar do not count. Second, this is a very useful tool and will probably take some practice for you to get really good at it. So expect to make some mistakes along the way. Any mistakes that you make, however, will actually be useful. We can look at what was confusing and see how you can do better next time, okay?
Okay.
Now, if you look at the top of the automatic thought record, you will find the directions. These will show you when you need to pull it out. It reads directions. When you notice your mood getting worse, ask yourself what's going through my mind right now, and as soon as possible, write down the thought or mental image in the automatic thought column.
Okay.
Now, let's take a look at the actual columns. The directions, as you can see, are at the top of each column. The first column is the easiest. When did you have that thought about Robert?
I think it was last Wednesday.
Okay, and would you happen to know what it was specifically, what part of the day or what specific time?
Wednesday afternoon around 5 p.m.
Okay, you can write that down in the first column. Good. Okay, now if you look at the second column, it prompts you to write the situation. What do you think we should write down here?
Lunch with Robert.
Okay. Okay, that will work. You can write that down. Good. Okay. Now the third column is for your automatic thoughts and how much you believe them. In this column, you write down the actual words or pictures that went through your mind. When you were talking to Robin on the phone about going out for lunch, what was going through your mind?
Well, I thought Robert rarely asked me to go out with him, let alone pay for me. So he probably feels sorry for me and sees me as a charity case.
Okay, so you had thoughts like he probably feels sorry for me and he sees me as a charity case. How much did you believe these thoughts at the time?
Maybe 95%.
Each?
Yeah, 95% each.
Good. You can write 95% next to your thoughts once you write them down. Okay, the next column, you write your emotion and how intense it was. What emotions were you feeling when you were talking to Robert?
I felt embarrassed and then maybe anxious about going out with him and depressed after I refused to go.
Okay, so in this column, you can write down embarrassed, anxious, and depressed. You could even write after refused to go in parentheses after depressed if you want. Okay, next you can rate how intense each emotion was at the time. This is similar to how we rated how much you believed your automatic thoughts.
I would probably rate embarrassed at 85%, anxious at 90%.
And depressed?
Probably 90%.
Oh, okay, good. Now, if you take a look at the fifth column, it tells you to identify the cognitive distortion. Do you still have your cognitive distortion list?
Uh, yeah.
Okay, you have it out, and for future reference, if you have this out and ready to use, it will assist you in filling out this column. You have it right there, okay? When you take a look at the list, can you tell me if you think your automatic thoughts fall into one of those categories?
Looking at the sheet, I'm thinking mind reading and maybe labeling.
Okay, good. It is actually both of those. Do you remember something that we talked about earlier? Sometimes automatic thoughts are true. Other times they turn out not to be true. And other times they may actually have a grain of truth. Can we look at these thoughts and see how accurate they are? Okay, Andy, what is the evidence that Robert feels sorry for you or sees you as a charity case?
Well, I don't have a job. My wife's income is not large enough to support my entire family.
Anything else?
Robert rarely asks people out. Moreover, for it to be his treat.
Okay, now is there any evidence on the other side that maybe Robert does not feel sorry for you, nor see you as a charity case?
Well, he is a really nice guy. He's very generous. He's always been willing to help people in need.
Yeah, it certainly sounds like he's a good guy, a good friend even. Have you seen him help other people in need before?
Yeah, I have.
And after the fact, did he talk about how he felt sorry for them or thought that they were a charity case?
Well, yes and no. He did feel sorry for them, a little bit anyway. He didn't see them as a charity case, though. Just as someone who had come across some hard times.
Okay, so why wouldn't that apply to you?
What?
Okay, let me rephrase. If Robert is willing to help other people he doesn't know that well, and he does not think that they are a charity case, why would he think that way of you, someone he knows pretty well?
I don't know. I guess he wouldn't.
Okay, so while your automatic thought that Robert may feel sorry for you may be true, it does not mean that the conclusion you draw from that automatic thought is true. So if we can switch gears here for a second, what's the worst thing that could happen if you were to go out to lunch with Robert?
I guess that he does think I'm a charity case, and that he uses paying for lunch as an excuse to rub in the fact that he's still employed and I'm not.
Okay, and if that were to happen, how would you cope?
Well, I suppose I try to be the better person and still thank him for treating me to lunch. Maybe show him that his being employed did not bother me. Maybe use the relaxation techniques you taught me if I felt myself becoming angry or anxious.
Okay, so it looks to me like you actually do have a plan of some sort to cope in this worst case.
Yeah, I guess I do.
Okay, that's certainly good to hear. Now, on the opposite end, what's the best thing that could happen?
I guess the best thing would be that Robert and I would have a nice lunch. Maybe he would even tell me about an opening in his company or get me a job or something.
Yeah, that certainly sounds like a good thing.
It's always a possibility, I suppose.
It certainly is. Now, what could be an alternative, maybe a more realistic explanation?
That Robert may feel sorry for me for having lost my job, but it's nothing against me personally. He's just being nice and wants to catch up since he has not seen me in a while.
That is certainly possible. Now that we have looked at some evidence for and against your automatic thoughts, an alternative explanation, a best case scenario, a worst case scenario, how much do you believe your automatic thoughts to be true?
Maybe 50%.
And are you still as anxious to go out to lunch with him?
I'm still a bit anxious, but not nearly as much as before.
Okay. How would you rate your anxiety now?
Maybe 60%.
Okay. And how about your feelings of depression or embarrassment?
Well, I definitely feel less embarrassed and depressed. I'd rate them both at 65%.
Good, good. Yeah, all of those scores are significantly lower than before. This is only one example of how identifying and evaluating your automatic thoughts can ultimately make you feel better, or at least reduce the degree of your feelings, such as anxiety. And if Robert were to call you again to meet him for lunch, would you make an excuse and refuse to go?
No, I think I would go with him this time.
Okay, so would you like to make that your homework assignment for this upcoming week?
Meeting Robert for lunch?
Yeah, it would be an experiment of sorts. By meeting Robert for lunch, you would allow yourself the opportunity to assess your automatic thoughts and test their validity and utility, rather how true they actually are. Coincidentally, it will also fulfill one of your goals to be more social and increase the amount of time you spend engaging in activities with your family, friends, or former colleagues. Does that sound all right with you?
Yeah.
Okay, since he called you last time, would you be willing to take the initiative to call him and see if he is available to meet you after all?
Yeah, I can do that.
Okay, and how likely do you think you are to complete this assignment?
90%.
Okay, good. All right, Andy, it looks like we only have a few minutes left in our shortened session this week. If it is all right with you, I would like to take these last few remaining minutes to summarize what we've covered today, and then I will ask you for your reaction to today's session.
Okay.
Okay, well, to start off, it sounds like your anxiety increased this week when Robert asked you to meet him for lunch because you had automatic thoughts such as he will feel sorry for me, maybe I am a charity case. You believe these automatic thoughts to be true and made an excuse to not meet him for lunch. We utilized an automatic thought record to discuss this situation and help you identify and evaluate some of your automatic thoughts. We also looked at the evidence for and evidence against such thoughts. Overall, the ability to identify and evaluate your automatic thoughts is a skill that we will continue to develop and keep practicing throughout therapy. We also reviewed the cognitive model a bit more, as well as the difference between thoughts and feelings, as well as how our thoughts affect how we feel and thus behave. We also discussed a couple of strategies that you could use to remind yourself to complete your homework for future sessions. Lastly, we collaboratively came up with your homework assignment to be completed before our next session. Do you think that about covers it?
Yeah, I think so.
Okay, good. Did you have any feedback for me about how you thought today's session went?
I thought it went pretty well. I definitely feel that I have a better understanding of the cognitive model and the difference between thoughts and feelings. The suggestions we came up with for me to do my homework will certainly be helpful.
Okay, and speaking of those suggestions, is the alarm on your phone?
It is now, yeah.
Good, all right. Any more feedback for me?
The only other thing that I think I'm going to like about using is using the thought record.
Mm-hmm.
It really does make things easier, and it's certainly a more organized way of doing things.
That's good. I am certainly glad to hear that. I appreciate your feedback and your understanding that today's session had to be shortened. I will see you next week at our regularly scheduled time for a regularly lengthened session.
Sounds good. I'll see you then.